Hello, I'm Dr. George Delgado, here to give you a perspective on the San Diego, California COVID-19 situation. As you know, the novel coronavirus is a very interesting virus. Over half the people who are infected with it do not develop any symptoms at all. Most people who develop it have mild flu-like illness, and it's only a small percentage of people who get very sick and who unfortunately die. Because it has infected so many people, however, we have had quite a few cases, quite a few hospitalizations, and unfortunately, over 250,000 deaths in the United States. But today, what I want to do is to give you some perspective and bring you up to date as what's happening in California and in San Diego. Let's first look at the worldwide situation. There have been over 56 million coronavirus cases documented in the world and 1.3 million deaths. If you look at the daily new cases, you can see that they're still climbing, as well as daily deaths are still climbing throughout the world. If you look at the different countries, look at the column in the far right where I've highlighted the deaths per 1 million population. This normalizes the count so that we can compare one country to another. In the United States, we've had very good tabulation of deaths, and there have been 771 per million population. India is listed as 95, but there's a lot of serious questioning as to whether or not India is counting their deaths or honestly reporting them. Brazil is ahead of the United States at 786 deaths per million, and France is in the same neighborhood with 715 per million. Spain has 899 deaths per million. The UK is similar to the United States at 783 per million. If you go down to Colombia, 677 deaths per million, although they instituted some of the most severe restriction mitigation measures around the world. Germany has been hit much less than other countries in Europe, with only 161 deaths per million population. When you look at Czechia, 626 per million, and Netherlands, 507 per million. And Sweden, although they started off with quite a few deaths, they are leveling off and now we're at 624 per million. Let's take a look at the United States now, with over 11 million reported cases and over 250,000 deaths. It's important to remember that only 5% of the people who've died with COVID-19 did not have an underlying condition, only 5%. Of those with underlying conditions who had COVID-19 at the time of death, 50% had hypertension, 36% diabetes, 32% with heart disease, 25% had some form of dementia, 18% with a chronic kidney disease, 14% with either asthma or chronic obstructive pulmonary disease, often known as emphysema, and 7% were immunocompromised. Some of the patients had multiple risk factors. If we look at the United States, the different states, again, looking at the deaths per 1 million population, that's the third from the right column, where I've highlighted certain states. Texas with 701 deaths per million, California at 466, not too bad compared to some of the other states, Florida with 826 per million, New York and some of the other states are over 1,000, New York with 1,753 deaths per million. And that's, of course, was driven by the huge crisis they had in the New York City metropolitan area where the coronavirus was spreading like wildfire. Georgia also relatively high at 854, Michigan 858, New Jersey, because it's close to the New York metro area, 1,889, Arizona at 874, and Louisiana at about 1,300. Connecticut is not shown here, but it also was very high like New Jersey. If we look at California, I want to show you what's called the RT, or the reproduction rate over time. Now, this is a measure of how well the virus will spread. At the beginning of a pandemic, it's called the R0 or the R0. As time goes on, we call it the RT. The reproduction rate is simply the average number of people that will be infected by another person who is infected. So for example, if the RT is 1, then one person on average will pass it to one other person who will then pass it to one other person. So the epidemic stays pretty steady. If the R goes below 1, then on average, one person will spread it to less than one person, and then the epidemic starts to go down. If the R is significantly higher than 1, let's say it were 2, then one person would spread it to 2 people. Those 2 people would spread it to 4 people, 4 to 8, et cetera. It grows very, very quickly. There's some evidence right now that in Los Angeles, the RT is in the high 1s and getting closer to 2. But in California, overall as a state, it's about 1.13. And it's been like that for approximately a month or so. The RT is a very, very sensitive marker and very accurate, but it's only accurate if you look back 2 weeks ago. So 2 weeks ago, we know that that number was very, very accurate. The number today is more of an estimate because all of the numbers of cases and deaths have not been reported yet. So 2 weeks ago, we know we can hang our hat on it. Right now, it's more of an estimate. Let's look at some of the California data. In California, you can see our total cases are definitely increasing. You can see here the increase in cases. When you look at our percent positive rate of our tests, this is a very good indicator. Our 7-day positivity is 5.3%, and our 14-day average is 4.8%. What does that number mean? It means if you did 100 tests today, on average, about 4 to 5 of them would be positive in the state of California. So that's pretty good. The WHO recommends that we're doing better if that is less than 10%, and we're doing especially well if it's less than 5%. We've been less than 5% for some time. Our 7-day average now has crept a little bit over 5% in California. In the lowest panel, however, if you look at the daily deaths, you can see that the daily deaths have not been increasing significantly. And you can see since the peak in the summer, daily deaths have gone down. And so that's because people who are getting infected perhaps don't have as many illnesses, so they're not as susceptible to serious illness or death. And because of our therapeutics have been improving over the last several months, we're treating and saving more lives because of our better treatments. In California hospitals, I want to direct your attention to the lower panel where it says ICU bed availability. That's a very important factor because we want to make sure that our hospital capacity is intact so that we can handle a surge. And you can see that we have about 2,300 ICU beds available in California, and that's out of about 9,500 to 10,000 total ICU beds in the state. So we do have more than 20% of the beds are available, so that's a very good thing in the ICU. When you look at Los Angeles hospitals, here you can see that again, the hospitalized patients and ICU patients are going up. But again, at the lower panel, you can see that the ICU bed availability is still strong at 700 ICU beds available in Los Angeles County. Let's look at San Diego County now, where the percent positive rate had been increasing since earlier in the month, but it looks like it's leveled off, and it's still very good at about 4.5%. When you look at the number of cases in San Diego, you can see that certainly we've been going up in the last month or so. And hospitalizations have gone up, but not as much as the increased number of cases. And that's because many of those cases are pretty mild cases that do not require hospitalization. If we look at deaths in San Diego County, you can see that they've been relatively level. And so that's a very good thing. So although more people are getting COVID-19, not as many people are dying of it. So that's really the most important indicator is if people are dying, of course, the next one being serious illness. If we look at our hospitals in San Diego County, you can see here that hospitalizations have trended upward. When you look at the turquoise bars, those are the non-COVID-19 patients, and the yellow bars at the bottom are the COVID-19 patients. So you can see about 25% or approximately a third of the patients hospitalized right now are COVID patients, 123 compared to all patients, 387 in this sample. Pardon me, let's go back to that. This shows just the COVID-19 patients, and you can see that the Yellow ones are the COVID-19 patients in the ICU, about a third of all the COVID patients, and the turquoise are the COVID patients in the hospitals. Now this looks at hospital census, and you can see that here the total people in the hospital is about 4,200, with about 387 being COVID-19 patients, the little yellow bars at the bottom. So this shows that about 10%, less than 10% of the patients in hospitals in San Diego are COVID-19 patients. It also shows that we have a lot of hospital capacity here. You can see that we are well below the 80% bed capacity line, which is 4,824 beds occupied, and there's another 20% reserved for COVID. So we would have to have lots of COVID hospitalizations in order for us to be in trouble with that hospital capacity in San Diego County. When we look at ICU beds, you can see that the turquoise small bars at the bottom are the COVID patients, and the yellow bars are the non-COVID patients. So you can see there that it's about 25% of all the ICU patients are COVID-19 patients. And you can see we're still below our current ICU bed capacity rate of 696. We still have about 200 more patients to go to hit that. And then there's a surge capacity up to 853 where we're licensed for even more beds. So again, our ICU capacity is doing well in San Diego County. Now let's look at the different tiers now. You've probably heard of this where the state has these different 4 tiers of varying spread of the virus. And so we are currently in the purple tier. The next less restrictive tier is red. The one after that is orange, and then yellow. And the way the state calculates this is based on 2 things. The average new cases per day over the previous 7 days, and the percent positive test. And there are some adjustments they do based on how many tests you're performing. Right now, San Diego County is in the purple tier, and it's not because of the percent positivity, because that's about 4.3%. That would rightly place us in the red tier where we were before. However, the adjusted case rate per 100,000 per day is up to 10.7. And that 10.7 puts us into the purple range because you have to have both to be into a lower range. And this shows the unfortunate consequence when overemphasis is placed on total number of cases. Now, what happened when we shifted from red to purple were these were the restrictions that were initiated. Retail establishments had to limit their clientele to 25% of the normal occupancy. Shopping centers, 25% of the indoor occupancy with no food courts. Restaurants were forced to go to outdoor dining only or just pickup. And places of worship, unfortunately, have had to go to outdoor services only. As far as schools go, if schools were already open, they're allowed to stay open, but schools that were doing distance learning and were planning to reopen have to delay their reopening now. So overall in San Diego County, to sum it up, the cases are up, hospitalizations are up somewhat, but capacity is looking very good, and deaths, which are a very good surrogate marker for serious cases, are stable. The best metrics to follow in this pandemic, again, the reproduction number, the RT, is very accurate 2 weeks retrospectively. And that's because it takes 2 weeks to catch up because of late reporting of data. A good source, if you want to look that up, is called RT Live. Emergency department visits for COVID-like illness are very good indicators. Hospitalizations are good indicators. ICU hospitalizations are good indicators. And deaths are good indicators. All these, in my mind, are much better indicators than just measuring cases, because cases can be very, very mild and they can be asymptomatic. So that can be very misleading. Advance and regression. To advance to a less restrictive tier, a county must meet both criteria that I mentioned, the average cases per day, as well as the percent positivity for 3 weeks. However, to regress to a more restricted tier, a county must only have missed one of those criteria for 2 weeks. So it's easier to regress, harder to advance. The WHO has warned against COVID-19 lockdowns due to economic damage. It's known that worldwide, millions of people are being pushed into poverty because of the mitigation factors of the COVID-19 era. We also know that here in the United States, alarms are being sounded. People are very concerned that suicide rates may be going up. In the past, there's been a very high correlation between young working men's suicide and unemployment rates. And that was shown in the Great Depression, in the Great Recession, and whenever we've had economic downturns. Of course, we have lots of unemployment now because of the mitigation factors. This could have a profound effect on our suicide rate. There also have been alarms rung about opioid misuse, and early statistics are showing that there's increased cases of opioid overdoses, including here in San Diego County and other places in the state, as well as across the country. Well, how about a vaccine? Well, we have 2 vaccine candidates that are looking like they're going to be approved very soon. There are about 100 other vaccine candidates that are somewhere in research and development. Pfizer says its COVID-19 vaccine is looking 90% or more effective. And Moderna has reported preliminary data where their vaccine is 94.5% effective. And this effectiveness means at preventing cases of COVID-19. The Pfizer BioNTech and the Moderna vaccines are both mRNA vaccine. This is the first vaccine of its kind. They've never manufactured an mRNA vaccine before. What an mRNA vaccine is simply is mRNA is a piece of genetic code that's injected into the body. It goes into the cells. In the cell, that code then is translated into a spike protein that is identical to the spike protein on the virus. That spike protein then is shipped out of the cell where the immune cells and the antibodies detect it as foreign and the body mounts an immune response. So then it's ready so that when the real spike protein arrives, it can squash it very, very quickly. Now, the Pfizer vaccine requires storage at minus 70 degrees Celsius or minus 94 degrees Fahrenheit. That requires very special freezers. That's going to be a problem with it. It can be stored 5 days in a refrigerator. The Moderna vaccine has an advantage that it only needs minus 20 degrees Celsius, which is what a lot of freezers are in medical offices and hospitals, and it can be stored for up to 1 month in a refrigerator. Pfizer has estimated it could have 50 million doses available globally by the end of 2020. That's enough to vaccinate 25 million people because it'll require 2 vaccine doses for that one. Moderna will also require 2 vaccine doses. So the 20 million doses it's promising to the US initially will be enough for 10 million people in the United States. So we'll keep you updated on the vaccines as more and more develops. I hope you found this update very informative and enjoyable. Keep up the good work, and remember, be prudent, be wise, try to keep your distance, wear masks when you're indoors especially. But above else, we need prudence from our policymakers so that the mitigation factors are not worse than the disease. Thank you very much and have a wonderful day. Bye-bye.